And we are back, dear viewers, after that amazing report when it comes to the matter of supporting deaf and mute. Of course, with us, we have two distinguished guests. We're going to talk about a really important case, which is about breastfeeding. With us, we have Nour, a certified breastfeeding specialist. And with us, we have Dr. Catherine, also certified in breastfeeding specialist. We're really happy to have you here today as guests in Hala Kuwait.
Thank you.
At the beginning of the episode, if we want to start with you, Nour, how does breastfeeding work exactly?
So moms get pregnant, and during middle of her pregnancy, breastfeeding, breast milk starts producing for the mom. So middle pregnancy, breast milk production starts, and when she delivers, she has something called colostrum, which is the first milk the baby takes, and it's very ideal for its immunity, for nutrition, and for a perfect start of life, if we can say.
Yes, and Dr. Catherine, if we want to talk about the part where breastfeeding, actually they say that it avoid the woman to have cancer disease and such on. How do you elaborate on that point?
Well, actually, studies have actually proven that breastfeeding can reduce a woman's risk of getting breast cancer, and the effect is cumulative. So most studies would say that the longer you breastfeed, actually one study says that for every 12 months that you're breastfeeding, 1 year, you're reducing your breast cancer risk, especially if you're a woman who has high risk of breast cancers, like you have a family history of breast cancer. So that will really help in reducing the risk. And the way the way breastfeeding reduces the risk of breast cancer, there are several theories that are being put out there, and one is that while you're breastfeeding, you have minimum amount of ovulation or menstrual cycles, so that your exposure to estrogen, which is a hormone that's been linked to causing breast cancer, is less. So the more you breastfeed, you have lesser periods, so less chance that you're breastfeeding. And there are also other theories that they think is causing that reduction of risk, and some of them think that since when you're a breastfeeding mother, you're prone to eat more healthy, you're prone to have more healthier lifestyle, and that as well reduces your risk for breast cancer.
Yes. Well, Nour, if you want to talk about breastfeeding and it's giving a chance for a pregnant woman to start to let's say reduce her weight and start to get back into the shape, does that really let's say is a great element in letting a woman get really reduced in her weight by breastfeeding?
So many moms get this idea that let's breastfeed because that will make us lose weight.
Yes.
Breastfeeding itself, like Dr. Catherine said, it gets you to eat healthier, hopefully, right? Because some moms would just say, oh, I need more calories. They would just eat other things. Why it helps you to lose weight? Because it, like breastfeeding itself, if you breastfeed for the whole day, you burn between 500 and 700 calories, which makes you lose weight, just like going to the gym, right? But without really moving, just making that milk.
Yeah. Well, actually, I've always had this question in my mind. Every woman who actually starts to get pregnant, it's like a cue for her to start eating whatever she wants and whatever she needs in her system. So I guess they give themselves an excuse that when you're pregnant, you can eat whatever you want and you can gain the weight that you want because you are pregnant. And maybe at the beginning of maybe the 3 months of pregnancy, or maybe 4 months, you start to see the woman actually starts to be really huge and really chubby, and she starts saying that it's actually because of, let's say, me getting pregnant and having all this appetite and everything. So is that really true that when they get really pregnant they start to have all this appetite and eating everything, or is just something psychology kind of part?
It's true in part because when you're pregnant, you have something growing inside you, so you have to make sure that you're getting enough calories for yourself and for that growing child inside of you. But as with everything, it has to be in moderation. It's not just an excuse that I'm pregnant so I can eat anything. It has to be healthy, because it's not healthy when you're gaining too much weight when you're pregnant, because it will set you up for for other conditions like gestational diabetes, hypertension, which would put you and your baby at risk. And it's the same with breastfeeding, right? I mean, some mothers would think that okay, I'm breastfeeding, and they say that I have to eat for 2 still.
Yes.
But still, everything should be in moderation, and make sure that actually with nursing, you only need to add just much calories in your daily diet. You don't need to really eat everything.
Yes. And Nour, if we want to talk about breastfeeding and side effects, does it really give some side effects to the breast itself? Like it starts to be like sagging and everything, or it doesn't actually affect it?
If we want to put a court for this, pregnancy is the one to blame. Okay.
Okay.
And it doesn't we live in a culture where pregnancy changes your body, yet it doesn't prevent us from having babies, right? But if a mom hears, oh, breastfeeding causes my breast to sag, then they would just stop breastfeeding. But it didn't stop us from pregnancy to have those stretch marks, for example. So the main reason for this sagginess, if I want to call it, is pregnancy, eating a lot, gaining a lot of weight.
And losing it again, like maybe in a really fast time.
Exactly. Losing all that weight suddenly and not breastfeeding will cause the breast to reduce in size in a faster way, right? Because if she's breastfeeding, then the breast will stay relatively large related to producing milk. But if she stops, then it's a more sudden drop in that size, which causes more sagginess. Just like anything else in our body, if you gain much faster and you lose very fast, then you will have the same effect.
Yes. And Dr. Catherine, when it comes to mammogram, is it safe for a nursing mother to go through a mammogram, or?
Well, the procedure itself is safe, but mammogram, a screening tool for breast cancer, is not the ideal screening tool for nursing mothers, because when the mother is nursing or lactating, the breasts are more dense, so it's more difficult to see those small fine lumps that you usually see in mammograms. So what's usually recommended is to have that lump seen by an ultrasound. So an ultrasound has to be done to determine whether that lump is, the content is fluid or solid, because most tumors would have solid, are solid filled rather than fluid filled. So, and then when you have that ultrasound, and then whatever the result, then the management will depend on the result. So if it turns out that the lump is solid, then further tests can be done, like biopsy, so to determine the cause of that.
Yes. And Nour, if we want to talk about women getting prepared for breastfeeding during pregnancy, how can they actually get prepared for it?
So if we can start before pregnancy and eat very nutritious food, because pregnancy and breastfeeding uses from the stores that women have. So if she's eating healthy, 3 months or more before pregnancy, and she's having her let's say recommendations of folic acid, then she will have more healthy pregnancy. Then in that pregnancy she can get herself educated, read a lot of resources, we can say trusted resources about breastfeeding, books, and she can watch videos of proper latching, for example, and caring of that natural birth and very being healthy throughout pregnancy will give her more chances to have healthy birth, which means earlier start of breastfeeding and having help with the first obstacles that come to her, if any, helps her a lot continuing that breastfeeding. So getting classes during pregnancy, getting help as soon as possible if anything occurs, having a breastfeeding counselor on the line with her, helping her, and if needed to see her, would give her an optimum result, if we can call it.
So basically the mom should attend our workshops.
Yes. That was what I was going to ask. And to actually wanted you to elaborate on is where can actually a woman find a workshop when it comes to these kind of matters? Because in our society is really, you find it actually that maybe when it comes to old, maybe let's say generations, they know everything, and the mother depends on the older generation, and so on. It comes to the every new generation. So when it comes to nowadays, where can a woman actually go and attend workshops when it comes to breastfeeding?
There are actually a lot of of sources nowadays where you can get workshops. There are, some hospitals would offer actually workshops for pregnant mothers in preparation for, birth and breastfeeding. Birth Kuwait offers workshops. The breastfeeding support program offers monthly workshops for mothers. So we prepare them for breastfeeding. We tell them what to expect, so that they can manage the first few days. They know what to expect, then they know what to do. And then during the course of breastfeeding, they can contact, we have our counselors. So we have a hotline, so they can contact the hotline, and a counselor is dedicated to them all throughout their entire breastfeeding journey, who can help them with whatever breastfeeding problems that they have.
Yes. And when we want to talk about breastfeeding itself, like the use of, or let's say, how can a child get advantage of breastfeeding? Like some kind of mothers maybe had some difficulties in feeding the baby throughout the breast itself. So when they start to take the milk and give it to the child throughout, let's say, a bottle. So is that exactly the same benefit that the kid has, whether it's the mother milk in a bottle instead of the breast, or it actually has to be connected to the breast itself?
If we can say that breastfeeding has a lot of benefits, it's the Nour. It's way better and more beneficial than breast milk. So it's more of breastfeeding. If your question, what would a baby who is given breast milk through a bottle be not benefiting compared to a baby on the breast, I can say things related to the suckling itself, like protecting against ear infections for babies, jaw alignments for teeth, how our jaw will be growing, things like this. In addition to that, breastfeeding works where when the baby suckles, that milk is exactly the baby's need in amount, how much the baby is drinking, and in quality. So if the baby is like having a flu from here or there, and then there are scanners on mom's breast that will see what is the baby having, and then the milk will be exactly what the baby needs, like immunity exactly for what he has, or maybe if the baby is having any deficiencies, then the milk will be customed for that baby. And that is something not a baby on a bottle with breast milk will not exactly get. But we can say that breast milk is amazing, and those moms who are pumping for their babies are amazing, and they are women who overcame difficulties in a beautiful way, that they had found a beautiful way to still give that loving milk to their babies. So we praise them and we say great job.
Yes, and we actually had, I've recently had a case in my family. We have triplets recently, and I've noticed like really difference between the three of them. Like the eldest one stopped having, let's say, breastfeeding for a while, and she tends to go towards bottle and everything, but she's really strong and huge and everything. But when it comes to the second child, he's more of a quiet person, and he liked watching television and starting to play with the gadget, and he stopped breastfeeding after the eldest one. But till now, the youngest one actually is still breastfeeding on her mother. She's really tiny. And
how old are they?
They're almost 2 years.
Awesome.
So, but mashallah, her IQ, the one which is breastfeeding, is really high. She's like really smart. She knows how to manage everything, and she's like the quiet one and everything. So I was just having a question like about it. Like, does that really affect the child? Like, if like she's almost 2 years and like having breastfeeding in the process itself, especially when they come for the size, like they're like two kind of huge kids, and she's like the tiniest one. So how does it work?
There really is a difference in the growth patterns of formula-fed babies and breastfed babies.
Yes.
And previously we have been sort of like, we are in this community where we saw that those growth patterns of formula-fed babies as something that's normal. But recently the World Health Organization has endorsed that they made a study, and they're actually endorsing this new growth chart that's based on breastfed babies.
Yes.
And they want us to look at it as the normal, so that what we were used to seeing as big is equals to healthy is not always the case. So what could be happening with this one is that the triplet that's still breastfeeding is in the normal growth pattern that we're expecting.
Yes.
And also you can say that breast milk is tailored to, as what Nour mentioned, tailored to what the human needs, so that that kid who's still breastfeeding is being given the best opportunity to grow physically, emotionally, mentally, with the help of human milk, breast milk.
Well, that's really amazing and really, let's say, great information we have over here, especially when it comes to the actual size of the kids, because like we always tend to see like whenever the kid is really huge and chubby, that's a healthy kid and the normal one. But after listening to your information, let's say that you provided, it's really amazing to know that the actual size is the normal size for the one who actually is breastfeeding. So thank you very much for your time and opportunity, for having you here in Hala Kuwait. Hopefully we'll have you again to talk more about this field, because it's a really huge field and a really big, let's say, a deal of a field to be discussed. So thank you very much for your time.
Thank you so much.
And with that, we're going to head to our report, which is about the Japanese film screening. So stay tuned to that.